Hello and welcome to our debate. We will be discussing how we are against staffing mandates. To get started, let's talk about where this starts in the beginning. As nurses, we all have a common goal, and that's to give great quality care to our patients. But that goal can be hard to achieve with a heavy workload and increased responsibilities. So the question remains, how can we best achieve that goal while still supporting nurses? According to one resource, he quotes, "The premise behind mandatory nurse-to-patient ratios is the minimum specific guaranteed nurse staffing will produce better patient outcomes and alleviate nurse workloads and increase job satisfaction." So that's where the idea of nursing patient ratios was born from, because they thought it would produce better patient outcomes and increase the job satisfaction. So many people argue that mandating a nurse-to-patient ratio is the answer that we're all seeking. But what if a ratio of 4-to-1 is heavier than a ratio of 6-to-1 on certain days? That's not solving any issues. The nurse may still feel fatigued and burn out at the end of the day. So then what's a different approach that we can take to help retain staff and keep staffing safe for both employees and patients? We believe the answer is acuity-based staffing. So let's talk a little bit about staffing mandates. Mandates would require hiring more nurses. We would have to hire more per diem nurses and agency nurses. That's going to cost a lot of money, so we're looking at increased costs and still possibly increased workloads. Nurses are unable to take a break without replacement because of the required ratio. We would be performing more non-nursing tasks. Patient acuity is not considered, the ratios are inflexible, and there's no real data that supports that mandates provide better outcomes. So the state of California back in 1999 actually mandated this staffing ratio. This mandate resulted in an increased workload and decreased nursing satisfaction. It was difficult for California to recruit nurses and keep them in the profession, and they were reported as having the lowest population of nurses. I know that's hard to believe. I think we all feel that if we had less patients in our ratio, then our staffing day would have to be better, but that doesn't seem to be what's happening. It's definitely not happening in the state of California. So far, studies conducted have found that these mandated staffing ratios do not support the position of pro-ratio movement, that ratios will improve quality. Studies have found that in the state of California, there has not been a significant impact on patient quality of care, safety, or length of stay. The American Nurses Association and the American Hospital Association are both against mandated ratios. The ANA feels that staffing needs to be based off of census, patient acuity, nursing experience, and available resources. And all of those things can change multiple times a day, so it's understandable why the ANA feels it's important to base staffing off of these particular factors. So with all this conflicting information, it's hard to support mandating a nurse-to-patient ratio. Nurses need to make an informed decision regarding safe staffing and realize that there's other options out there. What we found in our research is that hospitals can choose to pay a fee instead of following the implemented mandates. So let's say in Pennsylvania a mandate does go through that we have to have a 4-to-1 ratio. We could choose to not pay into that, so we could just pay a fee and not have to follow the mandate. So that can actually be cheaper than complying with a mandate because of the increased costs of paying for more nurses. So just because a mandate is put into place doesn't mean that hospitals are going to follow it. Through strict adherence to mandates and with no input from nurses related to changes in patients' needs, employers may impact patient care quality and adversely affect nurses' workload and autonomy. So an alternative to government-mandated staffing ratios is to have strong relationships between management and nursing staff. Having that strong relationship between those two entities could keep the government from intervening. Who knows how to best care for patients more effectively, nursing or the government? I think that's an easy question to answer. Pursuing nurse staffing regulations would divert nursing staff and management's attention into politics rather than where the real solution could be found, and that's in the workplace. So, safe staffing is imperative in healthcare, but there are other options besides mandated ratios. Quote, with the use of staffing plans and committees, hospital administrators and nursing staff jointly determine and implement staffing plans that will produce the best patient outcomes. So if we as a hospital come together as nursing and administration, we can decide what's best for our particular facility. That gives hospitals the autonomy to make decisions regarding staffing without being mandated to have certain ratios. This makes the most sense because it takes other issues into consideration when determining staffing, because we know staffing and ratios and patients, none of it is black and white. So let's talk about acuity-based staffing. Genesis Healthcare System recognized a need for a systematic method to measure the acuity of each patient to better help assign each patient into a group for the nurse to care for. And they did this because Genesis Healthcare, they had the same issues that we're all facing, that there's less staff, there's more patients, they're sicker than ever, and they realized we need to come up with a solution for this. They quote, one key issue was inconsistent policies across our health system. Some units, after a wave of discharges that left empty beds, would send nurses home to cut costs, others wouldn't. It was left up to the manager's discretion. Projecting a patient census was particularly difficult, which contributed to inconsistent staffing levels that required fast action and often involved unplanned overtime charges. It took the Genesis Healthcare team about 2 years to create a system that correctly calculated an acuity score, but it has proven to reduce costs of staffing and increase the quality of care given, and the article talks about how the nurses are happy with this decision. The system not only helps us get the staffing right, it also helps us justify our staffing decisions if a question arises. If asked why extra nurses were called in mid-shift on a particular date, nurse managers can point to the contact census and acuity levels to demonstrate the actual need for additional nursing resources. Adequate staffing levels based on acuity have shown to reduce patient complications and mortality, decrease medical errors, improve patient satisfaction, and reduce nurse burnout. So a little bit more evidence to support our debate. Though there's a strong relationship between more staff and lower morbidities, there's a lack of evidence to support the root reason. And to date, no intervention studies have assessed the effect of deliberate change in registered nurse to patient staffing ratios. So a lot of the studies that you're reading that is supporting mandated ratios, they weren't looking for deliberate changes in the ratio, they just happened to see a pattern. And a lot of the studies are done in tertiary healthcare centers where their morbidity is already lower than the hospital setting. So there's no real reason for administration to spend money on resources that are unnecessary. That money could better be spent on technology and hospital upgrades. Excuse me. Mandatory ratios, if imposed nationally, may result in increased overall costs of care with no guarantees for improvement in quality or positive outcomes of hospitalization. So mandated ratios not only going to require more money to hire nurses, but there's no guarantees that it's going to improve the quality or the outcomes. In conclusion, we're all trying to achieve the same goal, so let's keep an open mind to all options. Is allowing the state to mandate our workflow really the right decision for us? Let's work together with management and administration to find what's best with our facility, as each is unique. Thank you for listening to our debate.